When using Systane ointment, it's important to follow the directions on the product package. If you have any questions, be sure to ask your doctor or pharmacist. Do not use the ointment if it has changed color or is cloudy. Some eye drops need to be shaken before use, so be sure to check the label. Ointments are usually used 1 to 2 times daily as needed, and if using it once a day, it may be best to use it at bedtime. To apply the ointment, wash your hands first and be careful not to touch the dropper or top of the ointment tube to avoid contamination. After applying the ointment, close your eye and slowly roll your eye in all directions to spread the medication. Blot away any extra ointment from around the eye with a clean tissue. If you are also using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. If you wear contact lenses, remove them before using Systane ointment. Be sure to ask your doctor or pharmacist when you may replace your contact lenses. Some types of eye lubricants can be used while wearing contact lenses, so check the package to see if you can wear your contact lenses while using Systane ointment. And remember to tell your doctor if your condition lasts or gets worse after 3 days. When you first start using Systane ointment, you may experience temporary blurred vision, as well as minor burning, stinging, or irritation in the eyes. If these effects persist or worsen, it's important to consult your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks. Most people who use this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as eye pain, changes in vision, or continued redness and irritation in the eyes. While rare, a severe allergic reaction to this medication may occur. If you notice symptoms such as a rash, swelling, severe dizziness, or difficulty breathing, it's important to seek medical help right away. Keep in mind that this is not a complete list of possible side effects, so if you notice any other effects that are not mentioned here, don't hesitate to contact your doctor or pharmacist for further guidance. Before using Systane ointment, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to any of the ingredients in the ointment. It's important to talk to your pharmacist for more details about the inactive ingredients and potential allergic reactions. If you have any health concerns, it's best to consult with your doctor or pharmacist before using Systane ointment to ensure it's safe for you. Keep in mind that after applying the ointment, your vision may become temporarily blurred. It's important to avoid activities that require clear vision, such as driving or using machinery, until your vision has returned to normal. When using Systane ointment, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Systane ointment. If this ointment is ingested, it can be harmful and may cause serious symptoms. In case of an overdose resulting in passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, it is recommended to contact a poison control center. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. Systane ointment is used to relieve dry, irritated eyes. It may also be used to treat dry eyes caused by wearing contact lenses. This ointment helps to protect and lubricate the eye, providing relief from discomfort. It is recommended to apply a small amount of the ointment to the affected eyes as needed, especially before bedtime. Be sure to check the product package for any specific instructions and consult with your healthcare professional if you have any concerns about using this ointment with contact lenses or allergies. This ointment is typically used on an as-needed basis. It is important to follow the dosage instructions provided by your healthcare professional. When using Systane ointment, it is important to refer to the storage information on the package. Make sure to protect the ointment from freezing. If you are using preservative-free drops from single-use vials, they should be discarded immediately after use or within 12 hours of opening. Check the product package to determine when to discard the preservative-free product. If you have any questions about storage, be sure to ask your pharmacist for guidance. It's also important to keep all medications away from children and pets. When it comes to properly discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to dispose of the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.